Hi, Stacy. Thanks for coming in today.
Hi, doctor. Thank you for seeing me. It's good to see you.
Yeah, of course. Tell me what's going on.
Oh, goodness. Well, my friends have said that there's this thing called the change. So and they told me I was late to the party, but I think I'm there. I'm just having night sweats and hot flashes.
Okay.
It's awful. Just awful. I wake up in the middle of the night drenched, have to change, can't get back to sleep, and then the next day I'm in the office and someone walks up to me and says, "Are you okay? You're all red.
Yeah.
You're really sweaty." And that's 10 times a day is just way too much.
Yeah, no, I totally agree. When did you start noticing this?
Can't remember, but I think it maybe about 6 months ago.
Okay. And when you say the change, are you referring to menopause?
I think so.
Okay. Yeah, okay. So when was your last period?
I think that was supposed to be 6 months ago.
Okay, around there. It's hard. It can be hard to remember sometimes when you haven't had one for a while.
Yeah.
Okay, and you said you were having these hot flashes how many times a day?
Maybe about 10.
10, okay.
And then in the middle of the night, just wake up drenched. Not every night, but it's getting to be.
Yeah, and it sounds like it's really affecting your quality of life, so I'm glad that you came in so we can talk about this.
Yes.
Have you done anything to try to help these hot flashes?
No, I'm that's why I'm here.
Okay.
I don't know what to do.
Okay, yeah. Has anything made them worse?
I don't know if wine does, but I kind of see a little bit of a connection. I'm not sure.
Yeah. What about when you drink coffee? Have you noticed any hot flashes when you're drinking coffee, or are you a coffee drinker?
I'm not drinking coffee. So
Okay.
I can't say.
Okay. And are you currently in a relationship?
I am, yes, for
Okay.
many years.
Okay. Yeah. Are you married?
Yes.
Okay. And are you still sexually active?
Yes.
Okay. Have you had any pain with intercourse? Any burning?
Yes.
Okay.
Yes, and I don't want to bring it up to him, but it's on lubrication.
Yeah. No, that's a total. So, with menopausal symptoms, which it sounds is kind of what's going on right now, that's a totally normal thing to happen. So, why that happens is during menopause you lose some of that estrogen in the vagina, and the lining of it starts to become thinner. And there's other changes that go on too, but that's why you can experience some pain and just loss of lubrication. So another thing that's good to help would be like a water-based lubricant. Okay, so just so I can kind of tell you what some of your options are for these symptoms that you're having. So like I said, I think you're in the perimenopause period, which means before menopause. So since your last period was 6 months ago, we don't make the diagnosis of menopause until 12 months.
Okay.
So some of the options that we have you ever heard of hormone therapy?
I have. My mom had it, but that's been years and years.
Okay. Do you have any friends who are on it or anything like that?
I just have one friend, but she doesn't talk about it.
Okay. So with hormone therapy, sometimes there can be some nerves around it, just because people don't know much about it. But it sounds like with the hot flashes you're having and some of the vaginal symptoms, we can kind of start you on a lower dose if that's something you're interested in. We use the lowest effective dose for the shortest amount of time just to kind of get you through this period of while you're having these symptoms. But it's very safe. There are some questions that I want to ask you before that we would be able to put you on any hormones, though. You still have your uterus?
Yes, I do.
Okay. Have you ever had a blood clot? Okay. Do you have any heart disease? Any liver disease? Any history of personal breast cancer? Endometrial cancer? Okay. Is there a family history of breast cancer?
My paternal aunt.
Okay, but not your mother or anything? Okay, so those are the things, if you were to have any of those, we cannot start you on hormones, but since you don't have those things going on, that would be an option for you. So yeah. And with the pain during intercourse, the hormone should help kind of help that lining of the vagina become a little thicker and not as fragile too. So it should help with both your hot flashes and your vaginal symptoms, okay?